Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Today I wanted to answer some common questions we get about root canals. So what is a root canal? Root canal is when the tooth breaks into the nerve or decay gets into the nerve and we need to take out the nerve of the tooth. So you're still keeping your tooth, we're just taking out the nerve that's infected or inflamed, or so that it doesn't become infected or inflamed after the procedure. So after the procedure, your tooth will still feel like a tooth. It still has the pressure sensor ligament on the outside of the tooth. So when you bite and pop for and curl, you don't stop. It's still going to feel like that. It's still going to feel like a tooth. But your tooth will no longer have hot or cold sensitivity and it'll no longer have a nerve in it. After a root canal, you can actually drill on the tooth without numbing it. So that's kind of nice. But root canals are done when the tooth breaks into the nerve or a cavity gets into the nerve. When it gets to that point, you get two options. You can take the tooth out or you can do a root canal and save the tooth. If there's enough tooth left to hold on a crown, which will be needed after the root canal, I recommend saving the tooth. If it's past that, the good news is at my office, we also do extractions and implants. So an implant's the best replacement for a missing tooth. I can do the extraction here for you as well. But most of my patients want to save their teeth, and I do root canals at my office. So instead of having to refer you out to a different office and come back and then we do the crown, if the decay does go into the nerve during the procedure or you have pain, give us a call. We'll do the root canal. And then if it's a back tooth, it's going to need a crown after the root canal. I do have a same-day crown machine in my office as well. I've got other videos on that. So you can come in pain and leave with your tooth fixed, which is a service that a lot of our patients really like. Root canals have a bad reputation, I think mostly from how they were done 50 years ago and people allowing the pain to get so bad that they were in pain during the procedure somehow. I will never work you in my office unless you're numb. So we'll get you plenty of numbing. If you're nervous about the procedure, we've got laughing gas or nitrous oxide to take the edge off, but you're not going to have any pain during the procedure. I will check in with you multiple points throughout the procedure. When I start on the tooth, when I get into the nerve, when I'm cleaning it out, when I'm finishing, making sure it's not wearing off, the anesthetic's not wearing off for you. So we have a lot of options to keep you comfortable at the office. I will not work on you if you're not numb. Most of my patients say after a root canal something like, oh, wow, that was quicker than I thought, or oh, that was easier, or oh, I don't know why I worried about it so much. So that's the most common response I get. I've even had assistants tell me, you've entirely changed my perspective on root canals. So with the instrumentation we have today, root canals can be done safely, predictably, and effectively and quickly. So there's rotary instrumentation today that will clean out the nerve of the tooth. You don't have to sit there and take it out by hand anymore. We have a 3D x-ray machine in my office, so I can see the tooth in slices. I know how the nerve is going through the tooth. I know how to get the nerve out before we start the procedure. I recommend a 3D x-ray for anyone getting a root canal in my office. It's going to make the procedure safer, quicker, easier, and more successful. So if you have a cracked tooth, the tooth's in pain, you're having a toothache, the two most common signs that the nerve's going south is either lingering pain to cold or spontaneous throbbing pain. So if you have a toothache, whether it's cold-induced or randomly, usually a sign the nerve's headed south. After the nerve dies, sometimes it might abscess, get infected. You might see a bubble in the gum. It might just have like a pressure pain on it, but it might not be hot or cold sensitivity anymore. All normal. Again, the treatment for the abscessed or infected tooth is the same as the treatment for the inflamed nerve, which is to take that nerve out, clean it out. If the infection has gone past the tooth, I'll get you some antibiotics after the procedure to help that heal, and we'll monitor to make sure it does heal. After a root canal and crown, it's still your tooth, so it could still get a cavity down the road. It could still break. It could still have a problem. If that's a concern to you, we can take it out and do an implant. Like I said, if there's good, healthy tooth structure left there, I do recommend keeping your tooth. It's cheaper, quicker, and easier than an extraction and an implant. Post-operative recovery after a root canal. So after the numbness wears off, it might be a little bruisey, a little tender. That the ligament around the tooth, it still has the nerve in it. So that's good because you can feel, when you bite on the tooth, but after the procedure, it can be a little tender. So Motrin, Tylenol is needed, but you're not going to have any hot or cold pain after the procedure. So that nerve will be gone. It won't be sensitive to cold or heat anymore. And the tooth will just be a little tender. It might take a couple days to a couple weeks to settle. If it goes past that, give me a call. I'll either get you an antibiotic or a steroid to settle it down, or we'll get the bite adjusted. But mild bruisey sensation after a root canal is normal. Beyond that, if you have any questions, give the office a call. Root canal versus implants. If root canal still your tooth, that's great, but the tooth can still get problems. So I do both at the office. I'll always give you my opinion of what I think is best for you. And I'll leave the option up to you if you want to keep the tooth, do a root canal and a crown, or take the tooth out and do an implant. I do both. There's advantages and disadvantages to both. I will go over all of those in your situation and let you know what I would do if it were my tooth or my family member's tooth. I do both procedures as long as you're making an informed decision. Sometimes I have people say, doc, I know it's on a hope and a dream, but I want to save my tooth. Even if I get a couple years out of it, I consider that a success. I'm not going to be upset with you if it breaks. I know you're really pushing it here, but go ahead and do the root canal. Other times I have people say, I had a root canal once and to be redone, and I took the tooth out anyway, which can happen. It's rarely happens. and I don't want to go through that again. I just want the tooth out. I want the implant. And that's fine too. It's whatever you think is best for you. I just want you to make an informed decision and understand the advantages and disadvantages to each therapy. How much does a root canal cost? Root canal is one of those procedures where the front teeth are the cheapest. There's one canal or nerve slot in there. Middle teeth are the second cheapest. There's 2 nerve canals in there. And back molars, there's 3 or 4, sometimes 5. And those are the most expensive. Fees are oftentimes set by the insurance. So it's really going to vary on your insurance and what percentage they cover and things like that. So, I hesitate to quote prices to you without knowing what your insurance is. But, probably for a root canal and a crown, you're probably looking in the $2,000 to $3,000 range total cost. That being said, if you have 80% coverage on the root canal, it's a front tooth, you don't need a crown, it's a root canal and filling, it might be a couple $100, it might be 100% covered. So before we ever do any treatment, I'll give you the estimates for it and go over the financing options. So if cost is a concern, you're going to know going into it what the cost is to help you make an informed decision. And yeah, after the root canal, if it's a back tooth, it's going to need a crown. Front teeth sometimes just need a filling. So if you have any questions more about root canals, or you want to schedule an appointment at the office, or you're concerned you might need a root canal, give us a call, 703-451-4500 or dulacdds.com. Thanks.